I'm here with Dr. Maggie Rebel, physician with the Fertility Clinic and Chief of Obstetrics and Gynecology at LHSC. Thank you so much for joining us.
You're welcome. My pleasure.
What brings patients to the Fertility Clinic?
So the Fertility Clinic per se, patients come here either by self-referral or because they've been referred by their primary care physician or their caring obstetrician gynecologist in the community. They've been identified as having difficulty conceiving for anywhere between a year to much longer. And so they're brought to the fertility clinic for evaluation and then determination for treatment. As well, within the context of the fertility clinic, we also have a very active program for endometriosis and pelvic pain because that is associated with fertility issues. So we see patients sort of in two different ways. One, identified clearly as a fertility problem, and sometimes they get referred because of other issues that impact on their fertility.
So what makes the fertility clinic unique?
So there's a lot of things about the fertility clinic at London Health Sciences Centre that are very unique. First is we're actually one of the pioneers of IVF in Canada. So we and one other program battle a little bit for dibs for who's the first clinic. But back in the 80s, we had one of the first IVF clinics. It was a very different process in those days, but it has evolved a lot over time. So it has a rich history. Secondly, it's a program, it's a clinic that remains in the hospital, which is completely unique in the province, and I believe in other provinces as well. So we are not a freestanding clinic. We're actually integrated in with women's health care and the Department of Obstetrics and Gynecology. We're a very academic unit. We've done a lot of research. We provide care that is standardized, that is based on evidence-based research, not on a whim and a publication in the latest, women's magazine. And then the other issue is that we're the only accredited program to deliver fertility care in London. So those are pretty exciting things. The other thing I think that's important to recognize is that the fertility clinic offers a wide spectrum of interventions, from diagnosis and simple management options through to IVF, through to donor insemination cycles, donor oocyte cycles, and all of it is done on site here. There's no traveling to other communities, there's no traveling to other labs, and so we're able to offer a full spectrum service.
Thank you so much for spending this time with us and explaining more about what you do and about the fertility clinic here at LHSC. I'm Tanya Chop, bringing you Inside LHSC.